Is it time for California to move from a pandemic approach to an endemic approach when it comes to COVID-19? Good evening and thank you for joining us. I'm Carlo Cicchetto.
I'm Marcella Lee. Governor Gavin Newsom says, yes, it is time. He made an announcement this afternoon outlining how the state is going to do just that. CBS 8's Kirsten Holmes listened in on that announcement and joins us live now with what the governor had to say. Kirsten?
Yeah, Governor Newsom's Smarter Plan works to make sure Californians have access to necessities like masks, as well as PCR and rapid tests to help mitigate and monitor the virus's spread. Now, the governor says 2 years into the pandemic, it's time to turn the page.
Moving away from a reactive mindset and a crisis mindset, we are smarter 2 years later. We are more adaptable. We are more capable.
Governor Newsom outlined his Smarter Plan for moving California forward in the fight against COVID-19.
We are taking a more sensible and I would argue sustainable health care approach. We are not walking away. That we're taking the lessons learned and we're leaning into the future.
The plan is an acronym for shots, masks, awareness, readiness, testing, education, or keeping schools open, and RX, or treatments, because the governor says the virus will still exist but has become more manageable as immunity builds. Dr. Argentina Servin with UCSD says California is already living with another endemic.
For example, tuberculosis is a disease that's considered endemic to certain regions, like in California and our neighbors in Baja California, because of the climate, etc. But not everybody gets it.
But cautions everyone to stay vigilant to better protect yourself, your family, and your community.
So regardless of the mask mandate, at the personal level, me and my family continue to wear a mask. We try to avoid crowded spaces, always wear a mask indoors. We try to be as safe as we can.
And Dr. Servin says as they look forward, continue to expect guidelines to change as scientists are doing their best to predict what Mother Nature does next.
Not all of these models can account for mutations of the virus, new variants. We cannot account for that.
And Dr. Servin says because the virus is still a pandemic in other countries, Californians should beware when traveling, as some countries don't have the same level of access to vaccines as we do.
Haiti is less than 1%. Afghanistan is like 10%. So those are important things to consider.
Governor Newsom says the state is doing what it can to adjust to our new normal.
We have all come to understand what was not understood at the beginning of this crisis, that there is no end date.
The plan also includes benchmarks like stockpiling at least 75 million masks and the capacity to perform at least 500,000 tests and administer 200,000 vaccines every single day. The governor says California is not moving on from the pandemic, rather the state is just moving forward to the endemic. Back to you.
Kirsten, I think a lot of people are very hopeful that we're moving from pandemic to endemic. How else is the state moving forward in this fight against COVID-19?
Yeah, the state will move away from that blanket public health approach with measures that we all saw, and they're going to shift that responsibility largely to local governments.